This conference will now be recorded.
Hi, I'm Stephanie Blaufarb. I'm the Ovarian Cancer Program Director at Share, and I'm here with Dr. Blank, who's the head of the Gynecology Service at Mount Sinai. And we're here to talk about what this coronavirus and COVID-19 crisis means for ovarian cancer and other gynecological cancer patients. So to start off, I'm wondering, we've heard a lot from the CDC about recommendations for high-risk individuals to stay safe. What can you tell us about what cancer patients should be doing to stay safe during this time?
Well, hi, Stephanie. Nice to see you. What cancer patients should be doing to stay safe is taking every precaution just not to get the virus. So all of the things that you hear that you're supposed to do: wash your hands for 20 seconds, soap and water, stay 6 feet away from others, stay home, self-isolate, don't touch your eyes, your nose, your mouth. You should do all of those things. Clean and disinfect your home. Just really be vigilant about all these things. They do apply, they do work. So I think those are the things that I would tell people. Oh,
Okay.
avoid individuals that are not well, of course, as well.
Okay, great. Some folks have been wondering and calling our helpline, wondering, is it too risky right now for cancer patients to go to a hospital for treatment, or what should cancer patients be thinking about when seeking treatment during this time?
So great question, and it's really on an individual basis, I would say. So if you're on active treatment, you should certainly be communicating with your doctor's office about whether or not that treatment is continuing. Most of the time it would be if you're getting active treatment. Whether the place where you receive your chemotherapy is at a hospital or an outpatient unit, it is potentially preferable to be treated at a place that's not at the same place, at part of a hospital that's filled with COVID patients, for example. So being at outpatient centers, if possible, would be preferable. If you're getting follow-up, not actually getting active treatment, you may need to have that appointment delayed, and that would be something that you would speak with your doctor's office about. And then there are some treatments that are actually put on hold for different reasons. And again, it's on a very case-by-case basis, but in every situation, it's really weighing the risks and benefits of treating during this time.
Okay, and we're wondering also, or we've heard questions from patients wondering if surgeries are being delayed for cancer patients, and how is that going in places like New York, where we know there's more cases versus other places in the country?
Yeah, great question. I would say that everywhere in the country there are sort of prioritization of surgeries. So yes, cases are certainly being delayed in New York, where I am, where we have a really large COVID burden. We're not doing actually cancer surgeries unless they're need to be done within the next 6 hours, for example. So it really varies across the country. Other means are being used sometimes to treat people if that's possible. If you have a surgery coming up and your doctor or your team made the decision along with you to cancel it, it was not done lightly. It was really done considering all of the risks and benefits again. Frankly, right now in New York, nobody wants to be an inpatient in a hospital, let alone a woman with cancer. So we're really trying to weigh those risks and benefits.
But maybe, did you say something like, could you go more into the other treatment options maybe that might be available, you said?
Yeah, sure. So sometimes if somebody has ovarian cancer that looks like it's advanced, and rather than necessarily starting with surgery, which we oftentimes do, we might start with chemotherapy. That's something that's really being done in a lot of places around the country. Sometimes if you have ovarian cancer and you start with chemotherapy, the plan is to get, say, X number of treatments and then have surgery and then get some more. Now we might be giving more chemotherapy before that surgery. It's a safer thing to do than to have a big surgery during this time. With endometrial cancers, some endometrial cancers respond to hormones, and sometimes we can treat them in that way. And sometimes if the endometrial cancer is advanced, then that also might start with chemotherapy and not necessarily surgery.
Great, that's good to know that there's options, that's good.
There are options. And even if there is no active treatment being done right now, if we look at this it's not permanent delay, a permanent cancellation. We do think that if somebody needed, for example, sometimes people have their surgery delayed for 2 weeks for other reasons, they need to have a cardiac workup or something like that, and we consider that safe. So this is again something like that. It's just being done to make the surgery as safe as possible.
Okay, great. And then our last question is, there's been a lot of rumors and news about Advil use not being safe during this time. So I was wondering if you could clear that up for us.
Yeah, sure. So there's sort of conflicting data about nonsteroidal anti-inflammatory agents, or NSAIDs, and Advil is one of those. So it may not be a great thing to be on NSAIDs if you have the virus. Again, the data is mixed up. So what I would tell people is that if you had symptoms for which you want to take one of those agents, take a Tylenol or acetaminophen. That's a different class of agents, and it may take care of the same symptoms for which you're taking the Advil. If you have a fever, don't take either one of them. Just you need to monitor your fever, and you probably should call your doctor. I hope that helps.
Okay, yeah, great. Well, thank you so much for taking this time with us to answer all these questions. I wanted to highlight that we are actually planning to do a webinar with you, Dr. Blank, and also Dr. Melissa Frey, another great gynecologic oncologist who's, we're going to do a webinar on April 10th. And we're also going to be focusing on this issues on how things have developed and what this situation means for ovarian cancer and other gynecologic cancer patients. And in the meantime, please feel free, anybody who's seeing this, to call our helpline, 844-ASK-SHARE. We have trained survivor peer volunteers that are available to listen and support you through this difficult time. So I wanted to say thank you again to Dr. Blank.
Thank you for the opportunity.
Yeah, and there should be relevant links below. All right, thank you.
Stay well, everyone.